Hello, my name is Amy Sturkey. I'm a pediatric physical therapist, and I'm starting a series of answering questions of physical therapists that they have for me as a person who has a good bit of experience in pediatric physical therapy. So my first question is from Luis, and let's listen to his question.
Hi, Amy. I was wondering if you could help me with some questions I have here today. My first one is, what are some of the questions that you focus on for parents during the initial evaluation of your patients?
So I appreciate you asking me these questions. In terms of what I call an intake, at my practice we do an intake. So this means I talk to somebody on the phone before they come into my session, and that really helps me be prepared for the session when they come in, so I know what I'm getting into and have everything kind of ready. So when I'm talking to a parent on the phone, the kind of questions I'll ask is I'll start off, well, first I'll have to say is I don't have a list in front of me. I don't have a list of things that I check off. I do in my mind, but I don't have them on a piece of paper. And I think it's important because, well, for one, I can do it because I can usually think of everything. But for two, I want to make sure that I'm responding, I'm listening to the parent. I'm responding to their concerns. I'm not going down a checklist and just doing things. I'm listening, and what I ask bounces off of what they say. So given that, the kind of things I do is I start off with, like, tell me about your child and what your concerns are and why you're coming in and what their current gross motor skills are. And from there, again, often I will go off on a tangent starting with what they tell me, but once I've done kind of that, I just make sure that I know their pertinent medical history. If their birth history is important, that I know about that. If they have seizures, that I know about that. I ask, what if they're on any medications right now. I always ask what their height and weight is. This is important because in terms of equipment, sometimes you can know what equipment is needed according to their height. And their weight is important too, because that means if they've had a significant weight gain in the last year or the last 6 months, that I've used that as a reason. I had a kid in a year gained 60 pounds, and therefore, since he has spastic diplegic cerebral palsy, it's really important that he has therapy. Or he's gained child I saw this week grew 6 inches in the last year, so they're likely to be more uncoordinated. And so it's good to keep up with how tall they are, and just in terms of equipment, the size of them. Sometimes Medicaid or insurance will want to know, why are we getting a new piece of equipment now? And if I can say, well, in the last year he's grown 6 inches, 5 inches, he's outgrown that a piece of equipment, that's helpful to have. I always ask, in the last 12 months, have they had any emergency room visits or hospitalizations? I ask if their child is relatively healthy or relatively sick, and that sometimes leads into a discussion that's really helpful for me. From there, I think it kind of goes into what their diagnosis is. The questions I ask are really different. If they have cerebral palsy, I might ask which side is more stiff, or if they use their arms or their legs better. I'll ask what equipment they have or what orthotics they have. If a child is a baby, then I might ask about tummy time. If they have autism, I might ask how good they are doing things on imitation or on request, because that's going to tell me how easy the evaluation is going to go. I might ask what their stems are that they have. And I also, if they have autism, make sure I take a moment to tell the family that often the first visit is the worst visit, because the child doesn't know what to expect. The child's trying to change my mind of me working with them, and they don't know what's going on, and so the first visit is often the worst, so I make sure I tell them that. Regardless of the diagnosis, I usually ask about eating and sleeping, whether they're a good eater, and often they'll tell me about what their diet concerns are. They'll have 6 foods that they eat, and that's it. And whether they're a good sleeper or not. That's good to know, just in terms of if they're not a good sleeper, then you don't want to recommend night braces, for example, to help stretch out hamstrings or stretch out ankles. I always ask about constipation as well. A lot of my kids, if they have high tone or low tone, they're more likely to be constipated. And if they're constipated, if they don't have a bowel movement for up to 2 days, then the family needs to start doing something about that, or it can cause worse sequelae. And if they're constipated, they're more likely to have bladder control issues as well. I always, always, always ask likes and dislikes because well, I had a baby that came in the room and I asked the mom what dislikes she had, and she said this baby hates baby dolls. And a lot of times when I'm trying to help a family do an exercise, I'll pull out an exercise and I'll do it with the baby doll. Well, I would have lost the child right then and there. But likes are really important because if someone tells me that they don't like PT, and if I can find out what their likes are, then I can make sure that I incorporate their likes so they're more likely to enjoy PT. I always ask sensory issues. Are there things that they don't like the feel of, the touch of, or the sound of? And this often goes into a much longer discussion. From there, after I've hit all those points, I usually ask, do you have any questions that you want to ask of me before you come into this evaluation? I answer those questions. And the last thing I always say, is there anything that I should have asked that I didn't ask that you've just been dying to answer the question of if I just asked it? Is there something you want to tell me? And sometimes parents do. So that's the last thing I always ask. Luis, I hope that was helpful. These are just my questions. Another PT would certainly give you another, but these are the ones that have been really helpful for me over a long period of time. Thanks a lot. I'll talk to you another time. Bye-bye. So I'm actually kind of having fun with this series of answering questions. If you have a question that you want me to answer, just contact me. I'm amysturkey@gmail.com. Send me a question and I'll contact you back. And if you're willing to do a video asking me the question, we can talk through how to do that and how to get it to me. But I'd love to answer your questions. Just send them to me. Thanks. Bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.